Hi, I'm Dr. Natasha Wilks from High Performance Vets, and today I want to talk to you about managing client expectations. Now, why should you worry about client expectations? Can't you just have a consult, tell clients what they need to know, and then off they go and everything's sweet? No, it doesn't work like that. I learnt the hard way when I first graduated. I wasn't the best communicator. I really struggled. And since then, I've done a lot of work on communication and understanding clients, and it's made a massive difference with my ability to connect with clients, my ability to build relationships with clients. And I've learnt that if you're an effective communicator and you manage your expectations, then clients are a lot happier and everything is so much easier for you in practice. So what actually is managing client expectations? It's having that conversation where clients know what's going to happen. They know what the possible outcomes could be or the outcome is, and they know what they need to be mindful of. Now, this is important for any time you're doing any procedures, definitely for any pet that's admitted to hospital, and definitely for your chronic conditions. Think about it. How many times have you had a client come back and go, you treated it for skin disease and he's itchy again? Or you did a dental not long ago and you're saying he needs another one? How come? And what can happen is clients can then lose trust in you because they believe that you obviously don't know what you're doing, when we know that's not the case. So what it does is it gives clients perspective, because sometimes clients are all or nothing. They're very much like, well, you treated it, it should go away, and it didn't go away. So either you don't know what you're doing or you didn't actually fix it. So that's why managing their expectations is really important. And it's all about effective communication. Now, just because you can talk and I can talk a lot, it doesn't mean I'm effectively communicating. They've found with doctors that a lot of clients were only taking in or recalling 40% of what occurred in the consultation. And they also found that doctors would interrupt their patients within 20 seconds of the consultation starting. And look, I was very much guilty of that too. I'd be talking to a client and my mind would be so far ahead because everything I had to get done during the day. So I've had to learn to slow down, and I've had to learn not to just everything and tell them everything. I have to be very specific about what I discuss. But managing client expectations is about just telling them or communicating with them what's going to happen. So if it's a surgery, you make sure that they know that you're going to clip the neck when you're taking blood, that you'll have the leg clipped when you're putting an IV catheter in. It's really important when you're doing any form of surgery, for example, lumps, that you discuss with them how much is clipped. Because a lot of people will say, well, it's a little lump, yet he was clipped that much. How come? Or it was a little lump and he had a really big incision. So I explain to clients that this may be the lump, but certainly for stuff like mast cell tumours, we need to take margins. Therefore, my incision has to be like this. So the incision is going to be really long. And therefore, I need to clip this much. So I'll use my fingers and sort of draw on the dog. And especially if there's multiple lumps, you need to warn them. Because with clients with beautiful pets, with that lovely fur that's manicured, and then you clip it and you do a 40 clip, and there's big ball patches everywhere, it can be quite distressing for the client to see. Just think about your spays and castrations. Are you communicating effectively and managing expectations about what the surgery site is going to look like and what may happen with swelling or bruising post-operatively? And that's why it's really important to discuss with them the cone of shame and why it's so important. A lot of the time the clients know it has to be on, but they don't really understand why. And how many clients have said to you, well, he looks so sad and he wouldn't eat and it was just annoying us, so we took the cone off. And then, of course, how many days later are they back where it's all swollen, or, the really bad ones where, we have intestines hanging out. Never good, never good. It may not be our fault, but clients don't recognize that. They think it's our fault. And I remember this years and years ago with my best friend, where her vet had done, just a spay. She always had large breed dogs. I think it was a Rottie. And she said to me, oh, it had a little bit of fat hanging out. He mustn't have been a very good surgeon. And I was mortified. And that's when it made me realize you can do the best procedure and save a dog's life with emergency surgery. But clients, because they can't really know or understand what we do, they judge you on the quality of your incision and how it looks and the quality of the clip. That's why I'm very pedantic with our nurses, that they clip really straight. None of this is jagged. It has to look really nice, and it must be clean when the patient goes home. Now let's talk about admissions. For example, hospital patients. It's really important that you communicate effectively with the client about what needs to be done, what's going to happen to Fluffy, how long is Fluffy going to stay in hospital. We know if it's pancreatitis, it's just not overnight, but it's different if it's just a bit of vomiting compared to obviously being quite unwell pancreatitis. So little things that we think, well, that's obvious. It's not to the client. They don't see this. We may see things over and over every day and every week, but this might be the one time that the client experiences it in that year, and they don't understand. And with hospital patients, it's really important to manage client expectations, because they get very fearful, because this is their baby staying in hospital overnight. So what sort of bedding are they on? Is it going to be warm for them in winter? Is it going to be cool for them in summer? Are they going to be in the dark? And there's been clinics that I've worked at where we put night lights in because there was no external light coming in. There's no windows in the kennel room. So little things like that, it just shows that you care. And if the clients feel that you understand and that you know what you're doing, it just reduces their worry and anxiety, and they're more trusting of you as well. Now, something managing expectations is really important is the bill. You can't just admit it on a Monday, discharge it on a Friday, never have a conversation about money, and then wonder why a client's so upset and they never come back and they're ranting at the reception team. You must have that conversation every day, and you have to talk to them every day. This is where we're at. We're progressing well. I'm really happy. If this continues, we might go home tomorrow, or I'm still expecting him in hospital for another 2 or 3 days. This is what we're looking at for what we need to do today. This is your total invoice. Now, obviously, I'm doing it a lot quicker than I would do with a client, but it's really important that you communicate expectations and fees every single day and the total bill, because it's unfair to a client and it's unfair to the poor person discharging that patient if they're the ones who have to discuss money when the client had no idea and suddenly they've got to find 3 times the money than they expected. Another time I have been caught, and I've recognised, sometimes say they come in for a consult and you do cytology and you get a plan for a surgery and you give them an estimate. I used to get caught in that they thought the estimate included the today's visit, and it didn't. So I'll put it all together, or just say, this is what you're looking at for today, and then this is how much the procedure will be when we do it next week or tomorrow. And the other time to manage expectations is with chronic conditions. So like I said, skin disease, you need to manage client expectations about skin disease. How recurrent is it? What can you do to alleviate symptoms? And look, we've got a lot of great medication now that we can use, but you need to communicate it with clients. And it's the same with the ear infection. If they said, well, you came in for an ear infection and you treated it, and it's back again 3 months later, the clients think, well, it must have never went away. You didn't do a proper job. So it's explaining to clients why it has recurred. And this is the same for lameness, and it's especially the same for dentistry. You need to communicate and educate your clients. Now, remembering that clients won't retain everything you say, that's why it's so important to use other aids to help you. So use videos, record videos and practice. Make sure you've got handouts or you've got ebooks that you can send clients. And that way, when they get that ear treated and it happens 3 months later, they'll know, okay, that's right, Natasha warned me because of the skin or because he swims every day and I've forgotten to clean, that this was going to happen. Okay, then they recognise it's not my fault, but also they recognize that this is par for the course. Because remember, a lot of the time clients will think it's my fault, I didn't do it properly and it never got better. I've recognized in the 20 years since I've graduated that there has been a shift with client. It has been a shift with Google in that they have a lot more information. There's nothing we can do about that. It's okay. But sometimes a lot of clients don't want to take responsibility. So for things that go wrong outside of practice when they leave. That's why managing expectations is so important, because it allows them, and we shouldn't be taking responsibility for things that are outside of our control. So if Mrs. Jones takes Fluffy's bucket collar off and he licks at the incision all night and then it's infected or it needs to be resutured, I'm sorry, but that's not my fault. So that's why you really have to explain why it's so important to keep it on. But manage your expectations. If this comes off and Fluffy licks at it and it comes apart, it's going to cost you a lot more than the original procedure, especially if he's done a lot of damage. So depending on the type of client I've got, that's how I manage expectations. If they're really resistant or they don't want to follow our recommendations, then I'll say to them, this is what happens if you're not going to do this. And, I'll make sure that I've told them and they understand, then they take responsibility for it. Especially with lumps. I say, we need to take this lump off. And some people will go, I don't want to. I'm like, well, when this gets bigger, I'm going to warn you now, it's going to be a much bigger procedure, a much more expensive procedure. And because it's in a difficult area, we possibly have a lot more complications with it. And as long as you record that on your notes, then it's up to the client. Okay? But managing expectations is really important because, like I said, clients don't do this every day. They don't understand. So by effectively communicating with them, the clients understand why it's happened, what's going on, and what's going to occur down the track. And it allows them to manage conditions as well. And then what it does is it builds trust. Because really, this is all about building strong relationships with your clients. So that clients, instead of hopping on Google or going to the down to the pet store or down to the groomer, they come to us for our expertise. And that's how we build our reputation, we build good relationships, and you build a successful practice. Any questions? Write them below or, reach out to me on all the different social media channels. I'm happy to chat to you. But I'm Dr. Natasha Wilks from High Performance Vets. I hope you've enjoyed this video today.